Hey guys, and thank you for listening to the Campus Safety Voices podcast. My name is Amy Rock, and I'm the senior editor for Campus Safety. For today's episode, I got to speak with Dr. Rhonda Collins, who was a labor and delivery nurse for many years and is now the chief nursing officer for Vocera, which provides communication products and services for healthcare employees. Dr. Collins and I chatted about hospital violence and more specifically violence against nurses, which comes at a very crucial time since just a few weeks after our interview, a survey found that assault rates at U.S. hospitals increased nearly 25% from 2019 to 2020. Dr. Collins also shared with me her own personal experiences with workplace violence in her nursing career, how she has seen the violence evolve over the years, effective ways she's seen hospitals deal with this growing problem, both from her perspective as a nurse and also in her current role, and also mistakes she's seen hospitals make when addressing workplace violence. Here's our conversation. Be sure to subscribe to Campus Safety's YouTube channel and like or leave a comment on our videos, or subscribe to our Campus Safety Voices podcast on Apple and Spotify and leave a review. Can you just talk a little bit about your nursing background and career, just to give our listeners some insight into your background?
Sure. Thank you, Amy, for having me to have this conversation. I am in some ways a very typical nurse in that I was an adult learner. I was already a married woman with two small children when I went to nursing school. And I graduated in my late 20s with my first degree and went to work on night shift in labor and delivery. I mean, that's what I did. And I know so many nurses who have done the very same thing. When I decided to go back and get a bachelor's degree, I'd been working for about 10 years. And I put somewhere between 5,000 and 6,000 miles a month on my car going to school because we lived in West Texas and, distance is a thing out there. So I would get up at 4:00 in the morning every Tuesday and Thursday, and I would drive 3 hours to class. I would leave the house by 5 and I would be in class from 8 to 5 and drive back home and work the next day. And I did that for 2 years to finish that degree. And then, I took a year off and then I drove the other direction, 180 miles to class to go to get a master's degree and then eventually finished a doctorate. But I mean, those are things and my career moved along with that. I moved from being a bedside nurse to being a unit manager to being director over women's services to being a vice president. And it was at that point you look around and you say, well, I'm a vice president of nursing in one of the largest, most respected hospitals in the country. Where do you go from here? Mm-hmm. And it was life circumstances. My father died unexpectedly in a motorcycle crash, and my mother needed more of my time. My family needed more of my time. And I made the decision to go into healthcare industry. It was just a personal lifestyle choice. And I have to say, for the first year, I would wake up every day thinking, what am I doing? I just didn't understand. I was really floundering. And but then I really realized that what we did in the healthcare industry really impacted nurses. And it impacted not nurses at one institution, but nurses globally. And I became very committed and energized by the work. By knowing that I was making a difference in the lives of nurses everywhere. And that's really what has sustained me the last 18 years working in industry.
And it's amazing to have that nursing background first, because you can really, be an advocate for nurses versus someone who just goes into policy from the start. So that's really cool.
Right. Yeah, I was definitely a bedside nurse. And anyone who knows me knows that my heart still resides with those nurses that have to do that work every day.
Yeah, I think it's similar to, I spoke to someone the other day who was a school principal for 10 years and then got into selling body worn cameras. So kind of, he just says, my heart will always be in teaching, but, wanted to try out something different. So
exactly.
And I guess, can you, obviously the main focus of our conversation is hospital violence and specifically violence that nurses face. So can you speak specifically to incidents that you have experienced firsthand in your career?
Yeah, the first time I experienced aggression from a patient family was in nursing school. My first time in nursing school, I was taking care of a young woman and her significant other didn't like the fact that she was uncomfortable. And he got very aggressive and angry with me. And I was starting her IV under supervision. And he pulled a knife out of his pocket and he threatened me in that moment. And I just remembered thinking, you know, what in the world is going on? So, you know, obviously the supervisor who was with me alerted everyone, and he was escorted out of the hospital. And, you know, throughout my career, I've just had different incidences, and honestly, it's always for me been the family, because emotions are heightened. Folks are feeling anxious, and when they're in the hospital, it truly is one of the worst times of their lives. They're sick or they're injured, or, you know, you don't see people at their best. And of course, as we'll talk about more, it's just been exacerbated over the years. But, you know, I've been punched, I've been bit. I've had all of those incidences happen over the years. And, you know, I look back and we all were just like, well, that's just our patient. That's, you know, that's what we do. And I think the conversation, I'm grateful to see that the conversation is changing, that, you know, there's no other profession in the world where you go to work and go, well, if my customer bites me or punches me, that's just part of the job. I mean, that doesn't happen anywhere except in healthcare. It's like, well, that's your patient. So we've really got to talk about changing the culture of how we approach this.
And you said, you know, even in good times when people are at a hospital, like for, you know, when I had my kids, I remember my husband just feeling so helpless, you know, seeing
Yes.
someone you love in pain, even though it's like, you know, it's going to be a good outcome.
Yeah.
And you can see just like how emotions are heightened even in that situation. And so I can only imagine you kind of, you know, you don't want to sympathize with someone who pulls a knife out on you, but it's like you can kind of understand to some extent, you know.
You certainly understand how emotions can be heightened and how everybody brings their own luggage with them, their own emotional baggage when they show up in those situations. And, you know, we don't always have insight to all of that. So people act out. And I think especially over the last 2 years of COVID, with families and patients being separated, I truly believe our next pandemic is mental illness, because we have seen such an exacerbation of anger, just a fury that consumes our country right now, from every direction. And that definitely spills over into the hospital environment or the patient care environment.
Absolutely. We just covered, who was it? The American Academy of Pediatrics just came out basically with saying that there's a major health crisis, even for young children, when it comes to mental health. So I think, you know, they either are dealing with their own issues or they have adults in their life who are extra stressed for the pandemic. And that definitely trickles down to children. So I think it's just like an all around issue that obviously nurses
100%. It's, you know, nothing has been normal. Children have been separated from their social infrastructure of schools, and adults have been separated from their social infrastructure of work. And, you know, and I know that sitting here talking to each other on our computers has its own brand of fatigue and weariness and disenchantment or disenfranchisement, all of those things. And so when you think about taking one of your children or your husband to the hospital and then being told that you can't be in their room, and how that would make you feel. So I do believe, based on that, we also are going to have ethical discussions from separating families. We did it for good reason, but I think that it's created an ethical situation that we have to address on the backside as leaders in healthcare.
Now, obviously, these last couple of years are unprecedented, but you know, from your first incident that you experienced in nursing school till now, how have you seen workplace violence in healthcare settings evolve into what we're dealing with now?
Well, obviously, you know, healthcare is just a reflection of society at large. And so if you look at how we've evolved in our, you know, our rhetoric is ratcheted up, People can become keyboard warriors and say whatever they want to say, and they become used to expressing themselves that way. And so that just bleeds over into everything. We had here in Austin, a nurse who had just got off her shift, was still in her scrubs and was getting gas at a gas station. And a man saw her in her scrubs and just started screaming abuse at her and threw hot coffee on her. So now all over social media, you see where nurses are not going to work in their scrubs and they're changing back into their street clothes before they walk out to their car, because for personal safety. They're being escorted by security. And I follow several things on social media just to see how nurses are talking to each other. And they're all saying, take care of yourselves out there. Don't wear your scrubs to work. Don't wear them out of the hospital. Don't identify yourself as a healthcare worker. And I think that's a horrific tragedy, that instead of celebrating what these people have done, because literally they've saved our lives and we have to have them. Now, I had one nurse say to me, I never thought when I went into nursing that every night when I would drive to work, I would think about, is this the night I won't go home? And so I look at those things and I think, how have we evolved to this where nurses are afraid that they're for their very lives? Is this the night I will not go home to my family? And I do think it reflects the general boiling undercurrent of the country, and it just bleeds over into everything. And it's created a situation where, as leaders in healthcare, we have to reevaluate how we deal with it.
Yeah, everyone's just so divided in so many ways, and it's hard to comprehend why you would be so divided or angry at the people who are there trying to help you. And
it's just a general anger. And individuals with addiction drives mental illness, and then loneliness drives mental illness, and all of these issues that we've especially dealt with. We've always dealt with them, but it's really been exacerbated over the last couple of years, that it drives human behavior to the extremes.
And now, in your experiences, what are some effective ways you've seen hospitals deal with, workplace violence, or even, trying to help address mental health, in whether it be through policies and procedures at a hospital, implementing certain technologies?
Mm-hmm. Everybody has a policy and a procedure for workplace violence, everybody. If they really worked, we would have solved the problem, because I promise you, we've got tons of policies and procedures. But I think the number one thing that has to change about reporting is culture. And, when you have in healthcare a culture of either looking the other way, or, excusing the behavior because it's your patient, or it's your patient's family, then it makes it very difficult for nurses. That there is a culture among nurses of, you're not strong enough if you react to someone being aggressive toward you. Mm-hmm. And so we have to aggressively tear down the culture that's allowed that to flourish. And we have to address it, and we have to create the environment where nurses can freely and safely and report incidences that happen to them. The next thing is we have to have policies and procedures that reflect that have zero tolerance for either lateral violence among healthcare workers themselves, or violence from outside forces. And then third, equip them with technologies that allow them to call for help when they need it. It's not always convenient when someone has a grip around your neck to try to pull a string on a wall, or grab a button on a bed, or something like that, to enable them to have call buttons on their bodies, or urgent response, or duress calls on their body that they can reach, and be able to summon security, and everyone knows where they are and what's happening, and they can hear the conversation, can make all the difference. It can move from minutes response to seconds response.
Yeah, it automatically made me think of, how I think in a lot of hospital bathrooms, but some public bathrooms, they have like the pull thing for if someone's using the restroom and, gets injured, but it's like, if you're on the ground, you can't really reach that thing.
You can't reach it.
Yeah. So having something on your person is so important, and also like making it more difficult for someone with ill intentions if they wanted to like try and take that off of you so you can't use it. Having it that close to you provides more protection.
That is so true. And I can't tell you how many patient rooms I've been in where the call, the urgent call thing is on this wall over here and I'm over here.
Right.
And so it just makes it where it's very difficult to rely on that. And having something on your body is always the preferred way to reach out. And, unfortunately, we've had nurses who've, they've lost their lives in trying to care for their patient and have ended up, they just couldn't reach for help. Their only tool was to yell. And so a lot of times that's what nurses end up doing, is just yelling for help.
And I guess that's an example, but my next question that I was going to say is, what are some mistakes that you've seen hospitals make when it comes to addressing workplace violence? Again, whether it be through policy and procedure or through not having certain technologies, or there's so many other reasons.
Yeah, I think it's always just assuming that, the good enough, well, they have a call out, so that's good enough. Or, we have a policy that's good enough. I think that policies are written words on paper that we all agree in a cooperative, collective community to follow. But sometimes we have to hardwire behavior with technologies. It's like when a technology forces you to act a certain way or communicate a certain way, that's what you do. Just like email. I mean, we all email exactly the same way because that's how it's done. And so we follow that. So that's why I advocate, when you put a policy in place that really has life or death consequences, you hardwire that behavior, usually with a technology that requires them to respond in a certain way. I've heard from nurse executives, I've heard one way up in the Northeast that they actually they fired a patient from the hospital for his violent behaviors. He had come in more than once, and the hospital went through their legal systems and their legal roles, and they determined that this patient was a threat to everyone in the hospital, and discharged him and said he was never welcome back. So, I mean, hospitals are taking extreme measures to protect their staff now. That was the first I had ever heard of that, and it's the only one I've heard of since. But I think that hospitals have to look and say, what is the benefit of protecting my staff versus allowing this behavior to continue from an outside source? And when I say we have to aggressively address our culture of just going, well, that's what we do, we have to aggressively protect the staff.
And obviously nurses are very often faced with violence. And so what are some mistakes you've seen, or like you were talking about in the Northeast, or even heard about maybe common mistakes that nurses make when it comes to experiencing workplace violence?
Yeah, I think that we need to talk about training nursing staff, not turning your back, the language that you use, the tone of voice that you use. Certainly nurses who work in behavioral health are very familiar with all of those behaviors. We need to train everyone in the hospital. And again, we have to have policies that reflect our moral and legal position on workplace violence. And I want to be clear that there is such a thing as lateral violence in healthcare, because the people who've been caring for everyone are just people. They're stressed, they're tired, they're worn out. They are carrying their own issues from their own personal lives. And sometimes their response is inappropriate or can be aggressive. And so hospitals have to be willing to address that too, so they can calm the dynamics of the staff with each other within the hospital. And again, there has to be, number one, the culture of we don't tolerate this. just like the hospital I spoke of in the Northeast, to say, we've just decided that this patient can go somewhere else, but they're not welcome here. That this patient is a threat to our staff's very well-being. And so that is an extreme decision to make. But I think that more and more we have to become more comfortable with that and be willing to make those decisions.
It's such a highly charged environment, and we talk about what patients come in with, like their baggage, but nurses have baggage too, and they're dealing with their own thing. They're human. They're not robots.
That's right.
They have emotions, and sometimes they get out of hand just like anyone.
That's exactly right. You think about this last year, where people were having to remote school their children, and you see these families that are multi-generational, living in small spaces, especially in large urban areas. I mean, can you imagine the stress of always wondering, before we had the vaccine, before we really understood the virus, and in the early days, these nurses would go in and take care of patients all day long, and physicians as well, of course. And then they were always, I could be taking this home to my family, my fragile mother, my children who are at home. There was just this fear and lack of understanding, and you can see how that wears on people, and they become, less tolerant of stressful environments.
We haven't covered this in a while, but we covered, and I had never heard of it, but and it's not a physical threat necessarily, but nurse on nurse bullying as an example, or harassment by employees. Are there any other types of workplace violence trends or that seem to be flying under the radar that people aren't hearing about a lot, but that are a serious issue?
That is the number one issue. And when I talk about lateral violence, that's exactly what I'm talking about. It's the bullying issue, the nurses eat their young conversation, because we've had that conversation a lot in nursing. And it's a very valid conversation to have. We are facing a nursing shortage unlike any I've ever seen in my lifetime. We have nursing schools cannot possibly educate enough nurses for us. We have nurses who have spent the last year and a half, 2 years not allowed into the hospital to do their clinicals for nursing school. So, they're coming out of nursing school having done everything in a virtual environment, or having done everything in a simulation environment. Mm-hmm. And so they've got a nursing degree, they're licensed by the state board, but they're just now touching patients for the first time. And so, the older, more experienced nurses need to really step up and be more supportive and more collaborative and be willing to teach, because that's all of us will need a nurse before we leave this life, and we want them to be there for us. And so I do think that that's a very valid conversation to have. It's been going on for decades. It's a stressful environment. It's a competitive environment, because there's the good nurse and the nurse who's not as good, and that so there's, just like all human environments, it's human behaviors exacerbate under stress. You pressure cook it, and people's tendencies come out. But I think that as professional nurses, that in general, we are very aware of it, and we're very focused on solving the problem and calling it out and dealing with it in the moment. There are websites that deal with nurse bullying. There are conversations that occur at all levels. And there is a reducing tolerance for that in the work environment.
Okay. And we sometimes cover threat assessment teams for hospitals on campus safety. And it seems like a mistake that whether it's a hospital or a school, that they make is not involving the people that are the ones there on the front lines, and the upper management, who often don't have a strong understanding of what's really going on. What do you think about involving nurses in hospital threat assessment teams? And if they should be involved, how do you recommend?
Oh my goodness. I think it's one of the most important things you can do. I do think that what the pandemic has done has moved that nurse at the bedside, or that nurse that's doing the work, has moved them into the seat of authority. And I think that is one of the best things to happen to my profession in a long time. It's no longer the people who are behind closed doors in the boardroom making decisions. It is those people who are doing the work day in and day out. And we have to listen to what they have to bring to the table. They are the expert. And they, you can watch them work and see that they know exactly what to expect in the moment that it can happen. And so I think the focus has to be on equipping these people to hardwire human behavior, to allow technologies to carry memory for them. So just like you use your smartphone to remember your day for you, you don't commit all that to memory. You can't possibly. And so looking at what do I need to make my day work? What do I need to look at my day better? And one thing I will say is that we talk all the time about, burnout and resilience and all those things, and making nurses more efficient. But when you say things like that, you are inherently blaming the individual. You're saying, we need nurses to be more efficient. Well, you're blaming the nurse, you're not blaming the environment. And burnout is a work-related injury. And so we have to address the work environment, because that is what is causing this human behavior. And so when I talk to other nurse executives, I say, pick the top 3, 4, 5 things that create a congested, chaotic work environment. Can you relieve it with technology? Can you give them a tool? Can you relieve it with a policy or procedure, or both, a policy, procedure, or technology? What can you do to smooth out that particular workflow that frustrates, congests, and causes people to act out? And then move forward with it. Invest whatever you need to invest in it. If it includes the feedback from the nurses who are experiencing, number one, absolutely. Number two, can we look at national policies? And one thing I always encourage with healthcare is get outside your own echo chamber. Look at how other businesses or the corporate world solves some of these problems, because they've done it. Healthcare is not that different. We like to say healthcare is different, but it is a business, that's how it's structured. And we all have to conduct ourselves as such, and then give them the technology support tools. I mean, if you think about it, do you want to get through your day without your smartphone and all the reminders and all the information that's at your fingertips? The answer to that is no. Very few nurses get to use that kind of readily available technologies.
Mm-hmm. Having migrated from being a nurse to your current role, as Chief Nursing Officer for Vocera, what are some unique perspectives you have, either about available technologies or hospital safety in general, that others might not have? And what are some of the technologies that, you lead that you think would be beneficial to most hospitals?
Yeah, I look at all different work environments and protocols. There is a movement now to move a hospital at home. Basically, patients who are can be managed well at home with their family around them and a healthcare professional checking on them every day. And every aspect of healthcare, the very foundation of effective healthcare is communication between the family and the patient and the healthcare providers, and the extended teams. It's all about communication. I was recently a patient, and I got to experience it firsthand how I had to tell my story, I don't know how many times, because everybody who came in, and I was very frustrated by it. I was thinking, can you not read what the last 5 or 10 people asked me? And I told them all exactly the same thing, and it's all there to be read. So I think that we have to use technologies in the proper way that they're intended to help us do our jobs better. And so that's what I focus on. I focus on the process of communication. How do we make it more effective? How do we prevent errors with effective communication? How do we enable healthcare teams to work more seamlessly together? As a nurse executive in the hospital, I would see us spend millions of dollars on equipment or technologies, and they would be quickly abandoned because they didn't really solve the problem. And so a lot of my research and my work over the past few years has been on understanding what causes people physicians and nurses to adopt technology and what causes them to abandon technology. And so it's been very enlightening to understand it doesn't care how sophisticated or how important it is or how useful we think it might be. If it doesn't solve the problem, if it doesn't fit within the context of their work, they quickly abandon it. Mm-hmm. So that's really what I focus on in understanding, especially with Vocera, because what we do is we have hands-free wearable communication tools. We have integrations with smartphone apps to provide patient contextual care to ensure that nurses get the information and physicians, they get the information they need when they need it in the right context on the right platform.
And obviously the need to communicate isn't something unique to hospitals. It's so important for everything. I mean, I'm not diminishing that by any means. My point is that like across anywhere, that's the most important thing. And, you hear that all the time, like communicate, but like so many people don't. Even in your personal life, people, it's like, if you just talked about things, you could don't realize how important that is and how much you need that in order to operate. Like you were saying, healthcare is secondly a business, but in order to operate properly, you need to communicate. And it's such a fundamental thing, but people just forget about it. It's important.
It's so important. And, one of my big frustrations is, documentation with the EHRs is hugely important. And hospitals will spend years and years developing strategies and, a long-term plan and a short-term plan for their documentation technologies. But yet the very thing that drives teams in the moment that is right now and not, reflective like documentation is communication, but they will not have a strategy for that. I mean, frankly, the hospital I was at, nurses were carrying a walkie-talkie to communicate with the ED. They had a little ear thing that they had to press a button to talk to only the 3 or 4 people within their little thing. And then they were carrying a phone with ever-changing phone. Every single nurse was just loaded down with this stuff. And I thought, all that would require is a communication strategy, a real strategy to determine how many different problems do I need to solve. And also the residents were wearing pagers. They were like, look at this. And I started laughing. I said, the only people who carry pagers are drug dealers and doctors now. I mean, it's really dated technology. And they were laughing about that. We got a big chuckle from it, but that I looked at it and I thought it is really, it is a force of the human spirit that people get the right information to the right person at the right time when you're working with that many disparate communication tools that don't integrate or interface with each other. And I was like, that problem can be easily solved. That obviously that's what Vocera does. We could put everything on one phone and you could have everything that you need, or give the nurses one wearable and they could connect everybody in the hospital, not just the 3 or 4 people that they're working with that day. There's solutions to these problems. And I do think that it has to be taken seriously, because communication is everything from keeping people safe to causing no harm to patients, to facilitating patients through the system. And communication is essential to teamwork. It is essential to bringing people together with a common goal.
And going back to the beginning of our conversation about workplace violence, do you recommend any particular programs that are out there, or, is it just as important to speak to other hospitals in the area to see what they're doing for workplace prevention? Do you recommend a certain way to go about it?
For nursing in particular, I think that working with our professional organizations who have done a tremendous amount of work to evaluate and provide tools and guidance in solving for workplace violence. It is absolutely a focus of the American Nursing Association, American Nurses Association, to work with your state organizations, to work with other hospitals across the continuum, to it's like we all have to put our stuff on the front porch and be willing to talk about it, right? We all have to open the doors a little bit and say, yes, this is what we struggle with, because it's one of those things that we don't really talk about publicly. We don't really talk about how many cases of workplace violence have occurred in that year. If you go looking for those statistics, it's a bit nebulous to find.
Right.
But
Airing your dirty laundry, so to speak.
right. So I think that we have to be willing to include that in our reportings, our quality measures, because the quality of life for the individuals working in the hospital, it affects the patient, the family, and most especially our staffs. And I think that it should be a reportable measure of what we're doing to solve for workplace violence, what we've done to put in place. You look at hospitals across the country, it's very inconsistent. And usually when a hospital has been aggressive about it, they've had an event in their area that, really drove them to look for solutions so they can prevent that ever happening again. And I will say it again, we have to intentionally dismantle what has allowed us to get here, to be tolerant of it, or to be look the other way. So that means that we have to take a scalpel to it. We have to open it up and have the very uncomfortable conversation about what we do to change our culture, to change our policies, and then to equip our staff for their safety.
You see this too in even universities and schools. You see list the safest schools in America or the safest universities. And honestly, those lists drive me nuts, because sometimes the schools that have the higher reported crimes can sometimes be the safer one, because they're emphasizing the importance of reporting these things.
Yes.
If you don't have structure in place for students to do that, I think it's important, obviously in hospital too, to emphasize, like, report these incidents. Yeah. The optics might look great and the numbers aren't good, but anyone who's, really doing their research knows the importance of having a platform for people to report things,
Yes.
any form of violence.
That's exactly right.
And so in my research, I saw that you're the co-founder of the American Nurses Project. Mm-hmm. And so do you want to talk about that project a little bit? How it came about, how you got involved?
Yeah, you can see behind me some of my favorite pictures from the book. I was working for another company who is really the sole financial partner with the American Nurse Project, and that was Fresenius Kabi. And we worked together because we were looking for a way to honor nurses and to really bring the voice of the nurse to the forefront. And so we partnered with Carolyn Jones and brought Carolyn into the project. And Carolyn's the photographer and photojournalist who took the pictures and did the interviews. I wrote the afterword in the book and was a part of the first documentary. But what we really wanted to do was to allow nurses in their own voice to tell their story about why they are a nurse and why they do what they do. We have 75 nurses in the book. It's a coffee table book, so it's a beautiful book that you can put out. But we have nurses who are lawyers who tell how they ended up in that role. One of my favorite stories is a nurse in Wyoming who is Indigenous Native American, and her grandfather was their tribal medicine man, and how she has combined both her spiritual upbringing of her culture with her scientific education as a nurse, and how she brings that to her people. We had a story of one nurse in Appalachia who he drives over mountains and through streams to get to his patients, because top of the mine coal mining has just stripped the hills, and so the water runoff is extreme, and a lot of these homes are flooded in, and he has waders that he keeps in his car, and he puts his waders on. He carries his equipment in a waterproof camera bag so he can get into his patients. So it was just these remarkable stories, and I will tell you that it was life-changing for me, because I knew that nurses in general were very diverse, highly educated, highly committed, a group of individuals. I've been one for a long time. But to be able to talk to all of these nurses who live and work within their communities and make a difference to the health and well-being to the people around them, it was really a life-affirming experience for me. And I feel like it was one of the most remarkable things, projects that I was ever a part of in my career. And I'm still very, very proud of the work that we did and the stories that we told.
Mhm. Yeah, I think most people can relate to some way. If a lot of people know someone who's a nurse, love someone who's a nurse, and just know like deep down to their core the type of person that you need to be a nurse, to be a good nurse, a helpful nurse, an effective nurse.
Yeah.
And, you know, like you said, no one's going to leave this earth without needing one.
Nurses are, by the very term nurse, nurses are those who were committed to the health and well-being. We're there from the beginning to the end, and it's a very different discipline and practice from the practice of medicine. It is very much caring for that human body and that spirit and that family. And so I'm very proud of my profession. And I think one of my major drivers with the American Nurse Project was I just wanted everyone to see it the way that I see it, that it's like I wanted to give nurses this platform where they could speak and people could really see them as individuals for their community and global contribution.